Hi students, welcome to the next video of your bone disorders. Okay, in this video we are going to discuss about Pagets disease. Okay, Pagets disease. Pagets disease is not a fibro-osseous lesion; it is a different entity. So we should call it Pagets disease of bone. That is a real name actually. It is Pagets disease of bone. Okay, Pagets disease is a disease which affect your bone, and what happens here in Pagets disease is that there is abnormal remodeling. Okay, abnormal remodeling of bone means your bone is resorbed and remodeled in a different fashion. Okay, so there is a healthy bone that is first resorbed and it is remodeled and redeposited, but the redeposited or remodeled bone will have less properties than the original bone, or it will be weaker. Okay, it will be weaker or it will be abnormal, and it will be deposited in a different fashion. It won't be deposited in a proper architecture. Okay, so what happens in Paget's disease of bone is that there will be abnormal anarchic. Anarchic means uh, with a different architecture. Okay, anarchic means with a wrong architecture. Abnormal, anarchic, excessive bone remodeling, bone resorption. Okay, resorption and deposition. So what happen is that there is a resorption of bone and there is abnormal deposition. So the bone, such a bone which is formed, will be always having some kind of defect. So the a defective bone is formed, and this bone is always susceptible to fractures, or it don't have any properties as that of a strong bone. Okay, so this is Paget's disease. The other name for Paget's disease, it is osteitis deformans. Osteitis uh, deformans. So deformans, osteitis means something related to bone, and deformans is a deformative bone. And there is a gene which is responsible, a gene which is supposed to be responsible for this. That gene is called a sequestrum, XQSTM1 gene. That is sequestosome. Yes, sequestosome gene 1. It is supposed to be activating. What it does, it is supposed to be activating your osteoclast. So it is controlling the osteoclast. Now this osteoclast is abnormally activated, and they will cause the abnormal resorption. Okay, the exact reason for this Paget's disease is unknown. Okay, the real reason, etiology we don't know, it is unknown. But there is a question in your NEET examination. There is a question they ask: is there any virus which is associated with Paget's disease? It's a controversy, but still they ask the question that a virus which is associated with this Paget's disease, your measles virus. Okay, measles virus is the virus which is associated with this Paget's disease. Okay, so that is actually a controversy. It is not proven. Certain textbooks say so. Okay, now the main clinical features you want to see in this Paget's disease is that very important point is the age where this disease comes. This comes in the very older age group, and that too males. Okay, so it mostly comes after 40 years of age. Mostly it comes for 40 years of age, and males are most commonly involved than females. So I am telling this point very clear because you get cases, you get questions like this. They ask question like this: a patient, a 40-year-old man, okay, 40-year-old man with so and so bone lesions. Okay, so that 40-year-old man regarding a bone lesion with other features like bone deformity, okay, what skull deformity, and you have this radiographic features. They will give so many features related to Paget's disease. So you can make sure that this disease usually comes in the older adult people. So in the question also you can get a clue from the age of the patient. Male patient, 40 years. Okay, so if it's a fiber dysplasia, I told you, young individual, 15-year-old. If it is cherubism, it will like 2-year-old child. Okay, so from the age itself we will get a simple clue. Now what else is the findings here? Your maxilla is more affected than the mandible. Maxilla is more affected than the mandible. And what other feature you see is that you see swellings. Okay, you see expansion, you see swellings in the bone. Swelling bone, actually it is said that the bone is expanding. It will resorb and it will expand. So for example, if you are giving a denture to a patient, okay, you are posted in prosto, you are doing a denture, you take the impression, you take the primary impression, you take the secondary impression, and you have delivered a very beautiful denture. You sat the whole night trimming the denture, you made it so well, the fit is superb, okay, and you got the impression. And when the day of denture insertion came, it is not fitting. Usually, it doesn't fit because of our what skill. Okay, actually, I was having so much difficulty in Brosto. Okay, so actually, what we do is that then we will put some fix on and fix the patient, right, and tell them to okay, get out. Okay, so this is what usually we does. But in Paget's disease, the defect is that their bone morphology, their alveolar bone morphology changes. Okay, that is the issue. Okay, their bone morphology changes and more architecture changes. The jaw size changes. Their jaw expands actually. The maxillary jaw, actually the alveolar process, they expands because of the continuous remodeling of the bone. So the patient will come with a complaint that I have an ill-fitting denture. My denture is not fitting. Okay, so that is major complaint in this patient. So in the question also they will give you such a thing: a 40-year-old male patient coming with an ill-fitting denture. Okay, so this bone, you can see swellings and facial bones. Even in the facial bone, you can see the swelling, and that swollen up facial bone is called a. It will give a lion-like face. It is called a leontiasis ossea. Leontiasis ossea is a lion-like face. Okay, lion-like face. It can be seen in fibrodysplasia also, but very particular to Pagets disease. Leontiasis ossea is seen in fibrodysplasia also, but it is more particular for Pagets disease. Now, next, what you see is that their leg, the bones in the leg, in the appendages, they will get weak. They can't bear the weight of this person, so there will be bowing of legs. Bowing of legs. Okay, you can see the leg of this person will be. It is like they will have a bowing. Okay, means it bends as it cannot take the weight of this person. Okay, it cannot take the weight of this person, so the legs will be bent. If this is a person, imagine that this is a person, the legs will bend. Okay, because of bowing. Okay, and it is called a simian stance. Simian stance means simian is a monkey, just like a monkey standing. Okay, simian is monkey, just like monkey standing. And if you see skull, to take the skull radiograph, you can see that the base of the skull will become flat because of the weight of the brain. Okay, brain. It is called platybasia. Platybasia. And radiologically, the finding is that you can see the radiograph. Okay, see this. This is the radiograph of a Paget's disease. You can see that there is bone resorption and bone deposition. You can see that hazy appearance there. Okay, so this all the architecture, the bony trabecular architecture is all gone. Okay, it's all gone, and it is just like a fluffy appearance of this radio opacity. It is called cotton wool appearance. Okay, cotton wool appearance. Okay, cotton wool appearance in the radiograph. Okay, so that is called seen in Paget's disease. Okay, what else you can see in Paget's disease is that you can see all the tooth in the oral cavity has hypercementosis. Other thing is hypercementosis. You can see hypercementosis. All the tooth in the oral cavity, generalized. It is generalized. Generalized hypercementosis means most of all the tooth in the oral cavity have increased amount of cement. Okay, generalized hypercementosis, and alveolar ridge will be widened. Okay, your palate will become flat palate, and there will be spacing between tooth. If there is tooth, there is spacing between tooth. Okay, flat palate, alveolar ridge widens, alveolar ridge widens. Okay, so many features you can see in the oral cavity. Can you see this? This is the radiograph of your mandible, and you can see this fluffy appearance, a hazy appearance where the trabecular pattern is lost, and it is just looking like a cotton wool. Okay, so this is one finding in Pagets disease. Now, histology is not that important. In histology, you can see so many reversal lines. Okay, so many reversal lines, and the question mainly lies here about the what lab findings. Okay, lab finding means what you can see in the serum of these patients. Okay, what you can see in the serum of these patients, you can see that there is elevated serum alkaline phosphatase. In such patients, you can see that there's an increased level of serum alkaline phosphatase, very high levels of serum alkaline phosphatase. We say above 250 Bodansky unit. Bodansky unit is a unit of measurement, and serum alkaline phosphatase will be increased multiple times. It will be increased. But what about your serum calcium? Serum calcium and serum phosphorus, will it be increased? The serum calcium and serum phosphorus will be normal. Okay, normal. So these two will be normal, and serum, only the serum alkaline phosphatase will be increased. So in your fiber dysplasia, in your cherubism, all your serum values are always normal. Okay, serum alkaline phosphatase, serum calcium, serum phosphorus are all normal in fibrous dysplasia as well as in cherubism. Okay, but in Pagets disease, what is increased? Serum alkaline phosphatase. Now, there are other things which are seen in Pagets disease, is that in the urine of these patients, you can see certain substance, that is urine hydroxyproline. Urine hydroxyproline is increased. This hydroxyproline is a byproduct of your collagen destruction. Okay, and there is other things also, that is N-telopeptidase and increase urine C-telopeptidase. Okay, in the urine, you can see all these are increased. N-telopeptidase, C-telopeptidase, urine hydroxyproline, all these are increased. These are all products of your bone destruction or collagen destruction. So when there is increased amount of bone resorption and collagen damage is happening, all these things will be excreted through the urine. So this is one lab finding. This is a question area. Please note. And what about the treatment? You have bisphosphonate therapy. Okay, the treatment is bisphosphonates. Okay, bisphosphonates you can give. Here also you don't give radiation because there is high chance there is formation of osteosarcomas. Okay, so this is about Pagets disease. I hope it is clear to you. See you in the next video with a new topic.